Good morning to all. Today we are going to discuss about human physiology. From this human physiology, first we are going to discuss about alimentary canal and digestive glands. Living organisms require energy to sustain life, and alimentary canal and digestive glands in the body help provide energy by injection and digestion of carbohydrates, protein, fats, and vitamins. After absorption, the indigestible material is adjusted out of the body. During digestion, complex food substances are turned into simple absorbable forms by secretion of different enzymes from the digestive juices in the digestive glands. This entire digestion process by the alimentary canal with the associated digestive tract is called the digestive system. Alimentary canal. Food passes through the alimentary canal, which is divided into various parts: buccal cavity, teeth, tongue, and saliva. The process of taking the food into body is ingestion. It happens through the mouth, which leads to the buccal cavity. The buccal cavity comprises a muscular tongue and teeth. Most mammals, including human beings, have two sets of teeth during their entire lifetime. A set of temporary milk teeth, and also known as the deciduous teeth. Permanent or adult teeth then replace the temporary teeth. Adults have 32 permanent teeth comprising 4 different types: incisor, canine, premolars, and molars. The hard substance of the teeth is made of enamel, which help in chewing of food. Enamel is the hardest substance in human body, containing the highest percentage of material. The tongue is the muscular and fleshy organ attached to the floor of the buccal cavity. It helps in chewing upper surface of the tongue, known as papillae. Some of these projections bear the taste buds. The saliva secreted into oral cavity or the buccal cavity as electrolytes and enzymes that break down the carbohydrates. Next one, food pipe or esophagus. The food swallowed goes to the food pipe. Food pipe is or esophagus is a long, thin tube that extends further back and going through the neck and thorax. Thorax is the part between the neck and the abdomen and the diaphragm leading to the stomach. The mucus is saliva help lubricate chewed up food particles into bolus, which passes into the pharynx. After the pharynx, the bolus is led into the esophagus by swallowing. The bolus passes through successive muscular contraction in the esophagus known as peristalsis. Then stomach. The stomach inner lining secretes digestive juice, hydrochloric acid, and mucus. The mucus protects the lining of the stomach, and digestive juices help in the breakdown of the protein into simpler substance. The stomach has following major parts: a cardiac portion where the esophagus opens, the fundic region and pyrolic portion open into the first part of the small intestine. Then Small intestine. The small intestine is 5 meters long and highly coiled. It secretes juices and receives the secretion from the pancreas and liver. The digested food passes into the blood vessels and in the intestinal walls. This process is known as absorption. There are thousands of finger-like outgrowths on the inner wall of the small intestine called villi, which increases the surface area of the absorption. The absorbed food is transported to different organs by blood vessels, where is used to build complex substances like protein. The process is called assimilation. The undigested food then passes to the large intestine. Next one, large intestine. The large intestine is about 1.5 meters long and its function is to absorb small salts and water from the undigested food. The remaining waste passes into the rectum and it remains there as semi-solid phases. Through the anus, the facial material gets removed from the body from time to time. This process is called the egestion. The large intestine has serum globin. Then the cecum is a small blind sac that has some symbiotic microorganism. It opens into colon and divides into 3 parts: an ascending, a transverse and a descending part. The rectum is where the descending part opens and further opens out through the anus. Salivary glands. The 3 parts of salivary glands is responsible for the production of saliva. The patriots, the submaxillary and sublinguals. The salivary glands are situated outside the buccal cavity, where they secrete the salivary juices into the buccal cavity. Then liver. The liver is the largest gland in the body and it secretes the bile juice stored in a sac known as the gallbladder. The liver has 2 lobes. Hepatic lobules are the functions units that contain the hepatic cell. The bile secretes by hepatic cells goes through hepatic ducts and stored in the gallbladder. The hepatic duct from the liver and gallbladder forms the common bile duct. Then pancreas. The pancreas is located just below the stomach and the pancreatic juice acts on protein and carbohydrates to change them in a simpler substance. The partly digested food goes to the lower part of the small intestine, where the digestion process completes with the help of intestinal juice. In addition, the pancreas secretes hormones, glucagon, insulin, alkaline, pancreatic juice. Then alimentary tract comprises the mouth, pharynx, esophagus, stomach, small and large intestine, rectum and anus. The associated digestive glands are salivary glands, liver, gallbladder and pancreas. The digestion of the digested, undigested food that help the main parts of the digestive system, which is known as alimentary canal and digestive glands. Then role of digestive enzymes and gastrointestinal hormones. Digestive enzymes break down polymetric macromolecules into smaller building blocks, which helps in body absorbing them. Nutrients are absorbed by our digestive system rather than the food we eat. Food we must broken down into nutritional components, fatty acid, and then food broken into smaller molecules by digestive enzymes, which your tissues, cells, organs use for a variety of metabolic tasks. This process takes place time and produce amino acids, glycerol, fatty acid, and simple sugar. When you see and break down food into little bits, specific enzymes generated in various sections of your digestive system kick to finish the job. Then amylase. Amylase is a digestive enzyme that breaks down starch into tiny carbohydrates. These are two places where this enzyme is generated. To begin with the digestive process, salivary amylase is produced by the salivary amylase is produced by salivary glands in our amylase is a digestive enzyme that breaks starch into tiny carbohydrates. There are two places where the enzyme is generated. To begin the digestive process, salivary amylase is produced by salivary glands. Then the salivary glands in mouth, which breaks down starch and converts into maltose and smaller carbohydrates. Pancreatic, then the pancreatic juices are produced by cells and pancreas and flows to the small intestine through the duct. Amylase from the pancreas completes carbohydrates break down into produce glucose. Protein is break down into amino acid which help the building components of the component. Then pepsin denatures portion of the protein chemical bonds result in peptides which help smaller molecule. The pancreas produces trypsin and somatotropin enzymes, then chromatic enzymes that pass via pancreatic duct and in the small intestine. Then lipase, glycerol and fatty acids are formed when the lipase enzyme breaks down dietary lipids into smaller molecules. The cells of the stomach generates a little amount of lipase. Then the cells of the stomach generates little amount of lipase known as gastric lipase. Then this enzyme is primarily responsible for the digestion of dietary fat. The phenomena then this cells of the stomach generates a little amount of lipase known as gastric lipase. The enzyme is primarily responsible for the digestion of dietary fat. The pancreas generates and pancreatic lipase and operates the small intestine and the digestive tract principle. Then the tiny fat globules by bile generated in the liver and released to the gut. The fat globules are converted by pancreatic lipase into glycerol and fatty acid, which are tiny energy molecules. Although the principal gastrointestinal manifestation of systematic disease, they are critically that some system disorders have gastro, then vomiting, constipation, the gastrointestinal symptoms can sign and various immunological infectious endocrine disease and signs of various immunologic infection and endocrine diseases. Gastrointestinal manifestation can be first signs of symbols for which the patient can admitted in the critical care unit. In article we will discuss the GI manifestations of various trophic diseases. Then gastrointestinal manifestation of tropical device. Next one, enteric fever. Various GI manifestation of enteric fever or loss of appetite and loss appetite and weight loss and tongue and abdominal pain, soup, diarrhea and mouth constipation. Rarest GI complications have intestinal hemorrhage and performance. Then in colonoscopy and various sized punched out ulcers and coated and margins are found. The internal then the next one, dengue. Gastrointestinal systems are common in dengue patient. More than can half of patient presented at the vomiting abnormal pain. Then gastrointestinal manifestation, endocrine disease. In all 50 to 75% patients with diabetes and presented with gastrointestinal symptoms. The mechanism of gastrointestinal symptoms is due to central neurogenic response, the ketogenesis, gastric ani, and the combination of clinical history, physical examinations, and laboratory examination record for differential diagnosis from cholecystitis, acute pancreatitis, and mesenteric vascular insufficiency. Vomiting, abnormal pain associated with DKA and acute in onset in contrast to intermittent abdominal pain. Over days to week in intra-abdominal disorder and physical combination, there is generalized abdominal pain and then on physical examination there is the generalized abdominal pain, contrast localized abdominal and pain and infra-abdominal disorder. Next one, laboratory evaluation is DKA is requested to differentiate from the typical presentation of myocardial. Then next one, the gastrointestinal manifestation in thyroid disorder. We know thyroid, isn't it? In all 30 to 50% of hypothyroid patients have gastrointestinal symptoms. Gastrointestinal symptoms range from frequent bowel movements, diarrhea, chronic dyspeptic symptoms such as epigastric gain and fullness and vomiting. Sometimes intractable vomiting is also reported in hypothyroidism. There is gastrointestinal motor dysfunctions manifested and altered intestinal motility, dysphagia. In the dysphagia, which is due to direct compression on thyroid, esophagus and myopathy of striated muscles of pancreas and esophagus. In 27 to 37% of patients, there is increase in SGGOO and Graves' disease patients are increased risk of colic and ulcerative colitis. Some cases reports of primary biliary and reported in cases. Severe hypothyroidism may leads disturbance in esophagus physiology. There is reduced used by aptitude of contribute to gain molecules. One other gastrointestinal manifestation or decrease in lower esophagus sphincter pressure and all amplitude of esophageal parasite persistence. Okay. Then severe hypothyroidism may lead to disturbance in esophagus physiology. There is reduced velocity, amplitude of esophagus physiology, and disease in lower esophageal sphincter pressure, which all contribute to diarrhea. Other gastrointestinal manifestations are decreased appetite, while there is a weight of contribute to dysphagia. Then there is a reduction in persinalis and conceits. Although rate of severe hypothyroidism, there may be severe ileus and pseudo obstruction. Sometimes there is diarrhea in severe hypothyroidism due to the bacterial outgrowth syndrome. Severe upper gastrointestinal bleeds refractory to use treatment reported in university. Mechanism for gastrointestinal dysfunctions are multifactorial, with the possible explanations being alternation in hormone receptors, neuromuscular and disorder and myopathy. Thyroid hormone deficiency may influence. There is a transpetal flux by inhibiting Cl- or HO3 anion exchange, which have effect on intestinal motility. In 50% of patients with hypothyroidism, there is some degree of mild liver abnormality despite normal historical findings. Myxedema acids is found in some long-standing case of hypothyroidism, which is corrected by the serum to axis albumin gradient more than high protein content. Hypothyroidism patients are also at high risk and with the help of content. Next one, gastrointestinal manifestation in autoimmune disorders. Inflammatory bowel disease, ulcerative colitis and Crohn, and they are characterized by widespread and intestinal inflammation and ulcerations and antiphospholipid syndrome, antiphospholipid syndrome is made associated with the system lupus erythematosus are the isolated findings. Since gastrointestinal tract is highly vascular and rich in capillary. At catastrophic anigos ani and this system lupus erythematosus up to the 40% of patients and the system lupus erythematosus which have gastrointestinal manifestation. This manifestation may due to vasculitis or due to side effect of medications used for treatment. Diarrhea is the most common gastrointestinal manifestation which may due to gastrointestinal mortality disorder, gastrophageal reflux disease. Then up to 40% of the system lupus erythematosus have gastrointestinal manifestations. Next one, diarrhea and vomiting. Diarrhea and vomiting are common in adults, children and babies. There are often causes by stomach bug and should stop in a few days. This advice is the same if you have diarrhea and vomiting together or separately. How to treat diarrhea and vomiting yourself? Diarrhea and vomiting can usually be treated at home. The most important thing is to have lost office fluids, avoid dehydration. Stay at home and get plenty of rest. Drink lots of fluids such as water or squash. Take small sips if you feel sick. Carry unbreathed or bottle freezing your body. If there is give babies on formula or solid fluids. Small sips of water between feeds. Eat when you feel able to. It may help to avoid foods and that are fatty and spicy. Take paracetamol if you are in discomfort. Check the leaflet before giving into the child. Do not have fluid and then how long diarrhea and vomiting last. Do not give aspirin to the child under 16. Do not give child under 12 medicines to stop diarrhea. Do not make baby formula weaker. It is useful strength. How long diarrhea and vomiting last? In adults and children, diarrhea usually stops within 5 to 7 days. Vomiting usually stops 1 to 2 days. Diarrhea and vomiting can spread easily. And if you have high temperature and do not feel well enough to normal activities, try to stay at home and avoid contact with other people until you feel better. To help avoid spreading an infection, then wash your hands with soap and water frequently. Wash any clothing or bedding that has poo and vomit on the separately on cart was. Clean toilet seats, flush candles, then wash my any clothing or bedding that has poo and vomiting on it separately on the cart wash. Clean toilet seats for the other people if possible. Do not use swimming pool until at least 48 hours after your symptoms stop. A pharmacist can help with diarrhea and vomiting. Speak to a pharmacist and can help the diarrhea and vomiting. Speak to a pharmacist if you and your child have signs of dehydration, such as dark, smelly pee or peeing less than usual. You need to stop diarrhea for few hours. They may recommend oral rehydration powders. You mix and water to make a drink. Medicine and helps diarrhea to the few hours. You are worried about any baby under 12 months. Then a child of 5 years has signs of dehydration, such as fever and wet nappies. Your child stopped breast and bottle feeding while they are in. You are worried about baby under 12 months. You and your child have blood, diarrhea and bleeding from the button. You are and your child diarrhea more than 7 years, for vomiting for the more than 2 years. And this human respiratory system function and diagrams are you see in the diagram. Then this human physiology contains so many canal in our body. Food pipe, esophagus are present. Every the heart sustains our teeth mark elsewhere, which will chewing and manifestation of it. Quote, constituents of blood based on an opaque red fluids that flows freely throughout the body. It is denser and more various than water. The older characteristics first one plus red blood cells, white blood cells, granulocytes, monocytes, lymphocytes. Then red blood cells. Red blood cells are quite unit primarily liable for the transportation of elements throughout the body tissue. It's a clarity. Then white blood cells. White blood cells are unit and nucleate severely motile cells structure constant within the defense reaction and reparative activity. There are three forms of WBC. One is distinct to its structure and performance. Granulocytes. There are a multi-loaded nucleus and then monocytes. This area units biggest cells and blood and area capable of ingesting infectious agents. Monocytes are area of units liable and responsible against foreign substances within the body. They are usually found in the bodily fluids, nodes, spleen, tonsils, thymus, and enter the circulation throughout the body find channels. And platelets. The platelets are unit among littlest cell of the body. They lack nucleus and cannot perform person's biological then three types of blood vessels. Three forms of blood vessels are arteries, veins, capillaries, arteries. Then veins. First one arteries. Arteries are then these arteries can swirly tubes and muscular in nature. These blood vessels carry oxygen-rich blood from the center to any one of the tissues of the body. Arteria is one among the most arteries that arise from the center of the branches. More. The next one is veins. Veins are unit elastic blood vessels and carry deoxygenated blood from all elements to the body to the center. An exception in then capillaries. On reaching tissues, areas branch into extraordinarily skinny tubes known as capillaries motivate the exchange of drugs between the blood and tissues. Sinusoidals. Sinusoidal area unit cruciform wider capillaries give bone marrow, liver, bodily fluid, nodes, spleen and few endocrine glands. There will be continuous, discontinuous and fenestrated. The cellular composition of blood varies in different groups of animal kingdom. An introduction of blood biochemistry gives a proper indication of what happens to all our bodies by studying the enzymes released by damaged problem and locust treated upon.